Good afternoon, everybody. Last but not least, I'd like to welcome to the stage ReproActive.
Thank you. Currently in the United States, kids are not receiving all of the sexual and reproductive health information that they need. At ReproActive, we believe that all children should have access to accurate reproductive health information. ReproActive is a biannual subscription box meant to facilitate accurate, open, and trusted communication about reproductive and sexual health between parents and their children. Through qualitative interviews, we gained a better understanding of what our parents are facing today. To take you through this journey, we want to first introduce you to three different parents. This is Trisha. One of Trisha's children just started middle school. Trisha feels like it might be time to start talking to her daughter about consent. However, she doesn't want to make her daughter feel uncomfortable and doesn't necessarily know if it's right to just bring it up out of the blue. Dave has a 5-year-old son that's recently asking him, where do babies come from? Dave wants to make sure he answers this question appropriately, but wants to make sure he's not giving too much information too soon. Finally, this is Rose. She's a physician specializing in women's health. So she's actually had quite a few conversations with her daughter about her changing body. However, Rose thinks it might be time to start talking to her daughter about sex and contraceptives. But according to her daughter, she doesn't necessarily want another lecture from mom. So here we have 3 different parents, 3 different needs, and one concern, which is the well-being of their children. As a team of epidemiologists, strategists, designers, and engineers, we give you ReproActive, our solution to this public health dilemma. We have created an educational conversation starter kit that's sent right to a parent's front door. Each kit will contain age-appropriate educational activities for parents to do with their children. Prototyped with many different parents in mind, we've received positive feedback about having these types of conversations with children. Each kit will contain a treat to share between the parent and child, an educational pamphlet which will explain all of the contents to the parent, an activity for the child to do on their own, as well as an activity for the child to do with their parent. All of our information is based on evidence-based and peer-reviewed materials from sources such as for the Centers for Disease Control and Prevention, or the CDC. So you might be wondering, why a subscription box? At first we considered web or mobile platforms with educational games. However, after talking with our parents and our stakeholders, we realized that we didn't want to again mediate interactions between parents and children with a screen. Instead, we wanted to facilitate open, face-to-face communication so that we could foster a lasting connection between parents and their children. So what does our process look like? We'll be working with child experts to identify peer-reviewed, evidence-based materials that will then be loaded into our platform. Within our platform, our parents will then be able to see various kits and custom options that they can select based on their needs and their child's needs. That kit will then be sent right to their front door, where they're able to then have those conversations with their child. We will then request their feedback so that we can better understand how we can not only improve the kit's contents in our platform, but also improve the experience for both the child and the parent.
So our customers initially will be parents with children ages 5 to 11, but parents are a bit too broad to target generally. So on a scale from parents that don't want to talk about this topic at all with their children to parents that are extremely open and share everything already, we decided to target that middle range. So through our surveys and interviews, we found that these parents want to be able to talk with their kids about sexual health education, but they just don't always feel armed with the appropriate knowledge for what to say and when to say it. So let me show you what this market looks like in terms of potential revenue. Our total addressable market is about $1.5 billion. Our key assumption here is that our boxes will cost $25 and parents will get our product twice yearly. and we'll multiply that 50 by the 30 million US households with children. Our serviceable addressable market is about $1 billion. Approximately 71% of parents fall in that middle range from the previous slide. And finally, our serviceable obtainable market accounts for the fact that not everyone will use ReproActive. At the end of the day, we approximated that this is a $217 million opportunity. Looking at our competitive landscape, we can see that we actually accommodate all of the different aspects that parents care about most. During our interviews and customer surveys, we figured out that they care most about medically accurate information, they care about age appropriateness, they really want the ability to customize the content that they share with their children, and they want a way to establish a dialogue with their child. Since there are no subscription box-based services for reproductive health, we compared ourselves to the most common places that parents and children receive this information. It turns out that we're the only solution that hits all the key aspects that parents care about most. Our two key differentiators are customization and the fact that our product facilitates a dialogue. So how will we bring this product to market and scale our business into the future? Well, in year one, we'll determine the right experts to work with for content and the most cost-effective methods for sourcing our materials. And then in year two, we'll begin to market our product more strongly through our subscription box management service, Cratejoy. Cratejoy handles listing our product in their marketplace and payment processing. We'll identify potential partnerships from stakeholders like insurance companies and healthcare providers. So then in year three, we'll move to our own web platform from Cratejoy, because our own web platform would allow us to increase our level of customization and outreach. We'll also increase our marketing spend through ads on social media, parent blogs, and our magazines. So by year four, we're really ready to grow and scale. One growth goal we have is to reach parents of lower socioeconomic status. We call this our Buy One, Donate One initiative, where for every box bought, ReproActive would donate one to a school, library, or doctor's office. And this is the team that would make it happen. So now we ask you, will you join us in being ReproActive?
Great job, team. Judges, why don't you go ahead and jump in with any questions you have?
Yes, of course. Thank you. So here's kind of what I'm trying to figure out. Let's say I'm a parent for a 10-year-old kid. I buy this kit from you guys, very happy. But what happens next year? I guess what I'm trying to figure out is how will you guys continue to create value for me as my kid grows up?
Yeah, I think that's a great question. And one of the things that we're interested in doing is creating different content for the different ages. So I've put up here one of our appendix slides that just gives an example of some content that's already vetted by Planned Parenthood based on the age of the child. So if your child right now is 10 years old, maybe you are going to talk about puberty and body images. And then maybe when they get to 11, or maybe even later when they're still 10, you can start talking about things like privacy, internet safety, cover other topics on sex, and maybe even STDs. So the idea is that the solution would grow with the child.
Thank you.
So will each of these, I understand the boxes are customizable, but are they customizable to the extent where they can appreciate cultural or religious differences in the way that parents might want to approach this?
Yeah, that is another really great question. And part of our customer slide before is that we're targeting customers who are kind of in the middle range at first. So we're talking not super conservative, and people who already talk to their kids all about this probably wouldn't need this. But we want to get to a point where we can try and adapt and deal with everybody who wants whatever they need from this platform. And I think everybody can kind of agree that they want the best for their children. And that's the main message that we're trying to send, is that this information will help your child have healthy relationships in the future. So we're going to position it in that way, and hopefully that way we can be sensitive to everybody's religious and cultural needs.
When you were talking, go ahead.
Go ahead, Alisyn. No, you're good. You're good. Go ahead.
When you were talking with the parents, did you just talk to the three, or did you talk to a broader set of parents as you were doing your early interviews?
Yes. So Snehal, go ahead.
Sorry. Yeah, so we actually spoke to a dozen stakeholders. They range from teachers to church groups to child therapists to physicians. And then we also sent out a survey to parents, and we had about 16 respondents. And it was a really wide range of parents. There were parents, we collected demographical information too, so we could find out their ethnicity. So we had a broad range of parents who were responding. And the problem that all of them were facing was that, okay, we have all this information available, but when is the right time to talk to our kids about it? I have no guidance on this. And that was where we knew the gap was. And that's why we wanted to approach it there and put out our solution there.
And did you talk with them about buying a box for $25? Did that kind of, was that a part of the survey, or is that a part of the next steps of what you guys would look at?
So we actually sent out a prototype to 3 parents with a physical box with an activity as well. And we collected feedback on how they thought the product was. Did they find the information valuable? How did their interaction with the child improve? Was the child receptive to the activity? And we got really good feedback where they said that they found the information super valuable. The kids were actually very engaging when it came to the activity, and they also really enjoyed the treat. Yeah.
Did they say if they'd pay $25 for it?
We did not explicitly ask them about the $25. We didn't give them a price range on the product at that point. Yep.
Thank you.
So referenced on this slide you have up is the tickling exercise. I'm wondering how many expert-backed type exercises are out there and how they might get categorized into your different product offerings.
Yeah, that's another really great question. And as Snehal was saying, all of this information is out there. We chose the tickling exercise for this prototype because it's vetted for really small children, and that's just who we happen to know when we sent out the prototype. But there are a lot of websites out there that say conversation starters for parents, and ultimately the activity is meant to be a conversation starter. So we spoke with some health educators and other physicians and experts in the field, and they have these types of conversation starters already. So we will introduce that into an activity with the goal of facilitating a specific type of conversation. And just to give you an example of some other activities we've tossed around, it could be, for the child, a coloring book with the different pieces of the anatomy so that they can learn that, when they're 5 through 8 or something like that. So that's how we would be incorporating that information into an activity.
Are there any other questions from our judges? All right. Thank you so much, Team ReproActive. We will see you again in about an hour and a half.
Sounds good. Thank you so much, everybody.
Good job.
Great work.
Thank you.